Morning sickness is a tough one. Not everybody gets it. Some patients get it in the evening. So kind of morning sickness is a misnomer a little bit, and some patients get it the whole pregnancy. Some patients only get it at the end. Most of the time, it's first trimester. It's usually due to the rapid rise in beta HCG that happens between about 6 weeks and 9 weeks. It starts to settle down after about 9 or 10 weeks. So as they move out of the first trimester, the nausea typically gets better.
There are various medications that can be prescribed to help with the nausea, because it's very important to stay hydrated, and oftentimes early in pregnancy, patients that are having a lot of nausea fail to intake enough liquids, and so the medication that we can prescribe, as well as certain vitamins that are available that your doctor would prescribe, can help with the nausea. The other thing that's very helpful is in your diet to have very small, frequent intakes. Instead of trying to eat one large meal at once, it's best to have every couple of hours just a very small intake of food, as well as the liquids, and that seems to help. And if you tend to eat dry types of foods like dry crackers, dry cereal, dry toast, that's also very helpful too.
There's several devices that are out there that you can use, just like when you go on cruise ships. The little C-bands, the little pressure point things will work for that. There's some newer like TENS type unit, little electrical units that give a little vibration, works similar to pressure point scenarios that you can use. There's data that shows that if you increase a B12 in your diet, things like that, the B complexes, that may help settle it down. And we have medications we can use if we really need to.
Uncontrollable vomiting. Hyperemesis gravidarum is where your morning sickness gets a little bit too far for you to be able to control. And chronic vomiting could cause you to become dehydrated and lose a lot of your electrolytes.
In really severe situations, sometimes patients have to get hospitalized for IV fluids. Subcutaneous pumps we can use to use the medication regularly, so that these patients aren't getting too dehydrated and not starting to break down protein. As they start to break down protein in their diet, they start to build ketones. And as they build ketones in their urine and in their system, it makes the nausea worse. And so you get into this vicious cycle. And sometimes we have to go in and break the cycle by giving them some IV dextrose or sugar to try to get them enough calories to break the system, wash out the ketones, and sometimes that'll settle it down. But there's a couple of ways that we can get around that. Most of the time, it can be handled with diet adjustment and some over-the-counter medications, some prescriptive medications. It doesn't usually require hospitalization, but in rare situations it can.